New question, the member from Etobicoke North.
Merci. Thank you, Mr. Speaker. My question is for the Minister of Health and Long-Term Care.
Speaker, my question is to fellow OMA member, and speaking doctor to doctor, I'd like both of us know the ground reality of the fact that 1 in 3 Ontarians will experience mental health challenges in their lifetime. And of course, it's hopeful that society has come a long way in reducing the stigma. With that increased awareness comes the need for increasing supports. As you will know, Speaker, in 2011, our government introduced a comprehensive mental health strategy, Open Minds, Healthy Minds. In 2015, we enlisted the help of those who lived with mental health issues by creating the Mental Health and Addiction Leadership Advisory Council. I'd also like to commend the Minister for the neuropsychiatric expansion, my own riding of Etobicoke General Hospital, part of the $400 million expansion. Speaker, my question is this. Can the Minister of Health and Long-Term Care please detail the investments that our government is making to improve care for those with mental health or addiction challenges?
Thank you. Minister of Health, Long-Term Care.
Well, thank you, Mr. Speaker, and thank you to the member from Etobicoke North and a fellow physician for the opportunity to speak to an issue that deeply affects the lives of so many. Mental health does not discriminate. It affects people of all ages in every corner of the province, regardless of gender, race, culture, or socioeconomic status. We recognize that physical and mental wellness must go hand in hand for Ontarians to live their best lives, and we are providing $2.1 billion over 4 years to reframe the system. Addictions and Mental Health Ontario, representing over 200 addiction and mental health organizations in the province, has stated that what makes this announcement historic is not only the significant sum of the investment, but it's also how comprehensive the approach is. There is recognition of the importance of housing, the unique needs of historically underserved groups such as Indigenous, racialized and LGBTQ2S and others, and services that meet people where they are, whether that be in schools, the justice system, or the community. For those living with mental illness, their loved ones, healthcare professionals, educators, and anyone else affected by mental illness. We hear you and we support you.
Supplement.
Speaker, I would like to, in all sincerity, commend the Minister of Health and the leadership of Premier Wynne for what is truly a historic advance with mental health and addictions in this province. We know, for example, that 70% of young adults with mental health problems will actually, in fact, have reported their symptoms to have begun in childhood. And that's why this investment is so important, because it will help, going a long way to help actually identifying and treating mental health illnesses as early as possible. And as a fellow physician, my colleague will know that anxiety, panic, depression, mental health, mood disorders, post-traumatic stress disorder, and unfortunately even suicide or suicide attempts are on the increase. As a government speaker, you will know that we've increased mental health spending every year, but we need to do more to address the wait list and ensure that children and youth have access to those services. So my question is, Minister, can you please share the details of the various investments that we're making in child and youth mental health?
Thank you, Minister.
Minister of Children and Youth Services.
Minister of Children and Youth Services.
Well, thank you, Mr. Speaker. It was a real proud moment for me to be part of the announcement last week, joining the Premier and my colleagues as we joined advocates, stakeholders, people who have been advocating for mental health services here in Ontario at CAMH to make an historical investment into supporting children and youth here in the province of Ontario. It's important, Mr. Speaker, that when a young person needs help, that they have access to the services in all parts of Ontario. And I believe that this investment, this historical investment of $570 million into children's and youth services, mental health sector over the next 4 years is truly that. It's transformative and it's historical. Mr. Speaker, 12,000 more young people will get access to service this year, and by 2021, that will grow to 46,000 young people getting more services. I want to thank the parents out there, families, stakeholders, advocates for working with us to build and transform this mental health service in Ontario.